Okay, so my name is Rachel Wanjema. I'm from Clear Minds, Better Lives. And today we have a guest with us, a fellow Washingtonian who
Uh,
understands the struggle of Seattle. I'm going to give him the floor to introduce himself and tell us what he does.
yeah. So before I begin, I just want to say thank you to Rachel and
Mhm.
your team at Clear Minds, Better Lives. I really appreciate this opportunity that you guys are giving me to talk about mental health services and access to it. I really appreciate to see that you guys have a platform that
Mhm.
is geared towards just making mental health a real thing, right? Just like physical health. I think that's what it really comes down to is just helping people be more conscientious about their mental health. And more importantly, just taking the stigma out of mental health. And I think when people think about a mental health, sort of someone with mental health illness, they think of, like a homeless guy or something like that.
Right.
And it's really, really not like that. Or
Mhm.
sometimes it's always that uncle, that aunt, right? That everyone's just kind of like ignoring or whatever have you. But anyone really could have mental health um,
Right.
illness. So I really just appreciate that. Yeah. So my name is Tiras, and I'm a care coordinator at Valley Cities Behavioral Health Care. That's a mental health agency here in Seattle, Washington,
Mhm.
in the King County area. And my job, it's really hard to explain just because it encompasses so much. But the
Right.
best to really describe a care coordinator is social work, case management type of work. If you're familiar with that, if you're not, then kind of just go look it up. But it's pretty much social work, case management.
Okay, sounds good. So thank you. We're also glad to have you today. We appreciate you taking time to speak with us. And so today we're going to cover what you've told us as mental health services and the access to that and what that looks like. So the first thing I want to get into is what does it look like when someone is seeking out those services? Like what are the steps, someone should take, or when it comes to even the place where you work, how do you acquire patients? What does that look like?
Awesome. That's a really, really good question, right? So pretty much all this comes down to insurance. It's pretty simple.
Okay.
It really depends on what kind of health insurance you have. So we have here in the U.S. I'm sure there's a lot of people who are watching from all over the world, but
Mhm.
here in the U.S., pretty much most people fall under three categories. So you
Okay.
have what's Medicaid,
Mhm.
which is the Affordable Care Act that was passed back in 2010 by the Obama administration, and
Okay.
pretty much that helps folks who are lower income have access to health care,
Mhm.
or anyone who really falls under that range of income.
Okay.
So that's Medicaid, and then you have Medicare, and that's really for special populations. I don't know too much about that, but that's more people with like disabilities or older folks, seniors. Um, and then you have private insurances. So that's your Regents, that's your Blue Cross. Usually those insurances, most folks usually get them from the employer
Mhm.
or will go to the insurance market and buy, just like you would with your car insurance or have you. So Medicaid really is subsidized health insurance, and then private insurance is you're pretty much going to pay more out of pocket,
Mhm.
or your employer is going to subsidize a lot of that cost.
Okay. And so I know, like, for example, a lot of our audience or majority might be immigrants or, people who may not necessarily fall under like low income, but sometimes they're not able to qualify for insurance at times. So, in that case, where do you suggest that they seek out these services, or what would be best to do in terms of cost? Because, like you said, it comes down to that insurance.
Yeah, there is sorry. There's also an option to pay out of pocket. Um,
Okay,
that
right.
might be a little harder to find,
Hmm.
but yeah, there is that possibility to pay out of pocket.
Okay,
And
still an
if they are
option.
an immigrant, definitely reach out to. There are agencies, especially community mental health agencies, that
Mhm.
do work with. So they'll sort of work. They'll meet you where you're at, essentially.
Okay, so then can you explain to us that difference with community mental health agencies versus private mental health agencies?
Awesome. That's a really, really good question.
Mhm.
So community mental health really has a lot more access to clients, to the community that they're serving at hand.
Okay.
And they take a lot more of the Medicaid. And then the sizes are really different. So community mental health, you have, it's a lot more, they have a lot more clients and a lot more services.
Mhm.
Private agencies, they're more folks who are doing private practice.
Mm.
So they have a little bit more, they have lower caseloads, meaning the amount of clients that they're seeing is a lot lower, and the services that they offer are very few.
Mm.
And those folks usually take a lot more private insurances.
Mm.
And the really important thing here is if you do have insurance, you are able to call. Usually they have a customer service number. You
Mhm.
can call and ask, hey, I'm looking to get into mental health services.
Mhm.
I want to know what providers in the area um, that are available to me, and they're usually able to give you that information. But the other thing with community mental health services
Mhm.
and private practice is so community mental health really is trying to help people overcome certain barriers. So may have folks who are coming in who don't have jobs, maybe don't have
Mhm.
housing,
Mhm.
those kinds of things. So they have a lot more services to offer.
All right. And then do they cover what type of care do they cover? So I know when people think like taking care of yourself in a mental health aspect, they think of therapists a lot of the times. But in these agencies and these like centers, is it people that have mental health disorders that are really the focus, or what's the scope of care that is provided?
That's a really another good question. So private insurance, private practice really, they focus more of the counseling, I guess you could say.
Okay.
Um,
Mhm.
for out to other agencies for housing or employment or those kinds of things, or even substance use.
Mhm.
But then community mental health agencies,
Mhm.
they also offer those in-house. Like the agency I work for, Valley Cities, we do both mental health and substance use. So, and that's considered core occurring disorders. So you have
Right.
folks who are,
Mhm.
have a mental health illness and they're addicted to some kind of substance.
Okay. Yeah, that makes sense. I think it can get confusing for people sometimes, and you get like overwhelmed when you. It's the same thing like when you're trying to think like which hospital to go to. Sometimes you don't know, but I think especially because mental health is something that is just now getting a lot of attention in the recent years, that people have a hard time maybe figuring out where to reach out, where to find the things that they need to, and I know like one really big thing is a lot of the online services that have been provided, like
Mm.
the crisis text lines, the virtual like therapy appointments, stuff like that. And I know, it it's evolving and it's really cool to see. And it's nice to know that you're in that environment and you get to see some of that. And I know like I have personally worked like at a psychiatric like hospital, you would call,
Okay.
and you never know, mentally going into it, you think of the type of person you would expect to see there, you know what I mean, and then when it comes down to it, it's such a wide range of people that come in, and I worked on the adolescent unit, so it was kids that were 17 and younger, and it
Okay.
was really interesting to see. You would see kids that may have an array of mental health disorders, and then you would see a child who's come in for substance abuse, which like you say, they co-occur in the sense that they're going to be placed in the psychiatric unit of the hospital if that's why they're coming in. And it
Yes.
was very interesting. You would think like you were saying, it's that one aunt, or especially coming from an African background, that's what we saw, the person you
Mhm.
saw when Azimu on the street,
Yeah.
never even took time to really think about it. You just knew that something was wrong with them, and they're just over there. And so learning more about these services and how to get access is very important. What do you say is something that's challenging that comes to the work that you do? What are some challenges that you encounter? Because I know it's not easy for people to seek out help or to seek out this care. So how does that look like for someone who coordinates how that goes?
Yeah, I think the biggest challenge, I think in general, is just trying to make folks aware that mental health isn't it's not like when you break your leg and you
Right.
go to the, the ED or the emergency department,
Mhm.
and you see your nurse, you see your doctor, they give you a cast, and then 3, 6 months later, your leg is back to normal, right? Mental health is so different because a lot of it has to do with mental health processes and
Right.
behavior, right? And that's a lot more complicated. So I think the biggest challenge is trying to make folks aware um, that it's a lot more long term. It's
Right.
long term, and it definitely needs a lot of patience and just getting the buy-in. Getting the buy-in is so difficult.
Mhm.
And a lot of it just has to do with stigma, like we're talking about,
For
right?
sure.
All of
Right.
us are coming in with already like misconceptions of mental health. So
Right.
when you come
Right.
in, they're sort of like having to work twice as hard just to sort of address the issues. So I
Mhm.
could say that's really the major challenge is just getting that buy-in from the clients that are coming in.
And what would you say in terms of the population that you see coming in? Do you see like a big difference in terms of like diversity? Do you see a lot of different types of people coming in with different backgrounds? Because I know that in a lot of cultures, these are things that people are like, you have to figure out a way to deal with it,
Yeah.
like why are you going to the doctor to talk about, something going on in your brain? So
Right.
do you see a lot of diversity in the place where you work, or can you
I,
see that discrepancy in terms of, yeah, the ethnic backgrounds that come in?
I do actually. And I can't talk too much about it because but I can
Right.
sort of give like general
Mhm.
statements. But I can really testify to um, I think a lot of folks, immigrants that come in, they already have that notion that mental health is some bad, evil, whatever you want to call it, kind of thing. So a
Mhm.
lot of them sort of are more reluctant to it, or they underreport a lot. I think that's what I can really
Okay. Yeah, that's a good word. Mhm.
have some come in and they'll like say, all kinds of stuff. And then later on you find out, whoa, there's something else bigger going on here. And you're like, whoa, they never reported that when they first came in. So I think a lot of immigrants, and I think this is why you guys are doing this, right? It's trying to help people
Yeah,
be
for sure.
of mental health illness, just because it's hard to understand, right?
Mhm.
Especially if you're coming from a country that or a nation that sort of sees mental health as some bad, evil thing and whatever have you. And then you come to America where it's sort of like a lot more open, a lot more free.
Mhm.
And then, but you're seeing all this behavior, so you're confused as to what to do. So when you come to a mental health agency, then you're sort of trying to walk on eggshells.
Yeah.
So I can really say that that's one of my goals is really trying to help advocate for those folks who are just a lot more confused about what that looks like.
Yeah, that's good. I really like that. And we appreciate the work that you do. We know that it's not easy. And I think like another thing we want to make people aware of is just like how you go to the doctors for a wellness checkup, it doesn't mean something has to be completely wrong with you. Like your world doesn't have to be crumbling for you to
Right.
go and check in with someone, especially in terms of like counseling and getting services like that. Um, it's very beneficial. A lot of people that do it testify and they say, like it's made my life so much better. I have a different perspective now. I know how to deal with adverse situations in a better way, versus just coming in when things have completely come crashing down on you. And I think it's very important for people to understand that getting a check-in is not bad. Going and getting a checkup or just, getting evaluated. There's nothing wrong with that. And it'll help you also in the long run.
Yeah.
Especially, I think of people who may have like family history of
Yeah.
disorders and things like that. It's the same thing. Like if in your family, hypertension runs
Yeah.
in your genetics, you want to start paying attention to those things early to make sure that you're doing everything you can to make sure that you're in check and make sure that you're staying healthy. And so mental health is the same. You want to take care of your mind before it becomes too late. And then, now you're stuck in this, like you said, it's a cycle. And I think what people also have to understand is, like you said, it's long term. it's like a lifelong thing you have to deal with, just like you deal with your physical health long term. Your brain is also going to be there your whole entire life. So you have to learn how to nurture it and tend to it too. But thank you
And
so much. I
very
really appreciate what you've talked about for sure.
Yeah, you mentioned something really important. It's sort of the family history, right? And I
Yeah.
feel like a lot of families don't talk about mental health
No. No.
illness, right? And
Mhm.
later on, you find out, yeah, my great grandmother had, depression, or even my aunt, or whatever have you. So I think just getting families to talk about it,
Mhm.
and creating an open, safe space to talk about it is really key.
Mhm.
Yeah, so I'm for all of that.
For sure. Well, we appreciate all the insight you've given us, a little glimpse into what you do. I don't know if there's anything else you'd like for us to know when it comes to mental health agencies and what to
Yeah.
do, how to go about it before we close off.
Sure. I can sort of talk a little bit more about what start to finish kind of looks like, maybe,
Mhm.
just so
Yeah,
you have
sure.
an
Yeah.
idea. So usually when you come into a mental health agency,
Hmm.
all you really need is an ID. You just need to have your name and your address. Pretty
Hmm.
much that's it. And then of course the insurance part of it, if that's something that they take, or
Right.
if it's out of pocket. And then after that, they do what's called a mental health intake,
Hmm.
and that's where they ask you a whole bunch of questions. It's usually about an hour and a half. That's average. And then after that, you usually see what's called, what we usually call a care coordinator, which is me,
Hmm.
or someone who's sort of able to do what I do, which is they help you connect to different services within that agency.
Okay.
They kind of help make sure that everything runs smoothly with your care. And then they help you connect with your mental health counselor if you're looking to get into groups, or if you want a peer partner, that's somebody who's sort of gone through the full scope of recovery and they kind of walk along with you the process. And there's just a bunch of services that they can help you connect to. And once that's done, then you sort of are able to kind of do it on your own. So after that, you just kind of um, get into it, and then, like I said, it's long term, and then you just kind of check in, like Rachel said, and you'll be fine.
Yeah. Thank you so much. It's not hard, like we see. It's kind of like checking into the hospital, really. You just go bring your information and then they'll set you up and they'll figure out how to make the next steps work. And I'm sure that even if there's something that you maybe might not have, you'll be able to point them in the right direction if that's the case. So I hope everyone listening will understand and have a bit of more knowledge when it comes to mental health agencies and how they work. And once again, we appreciate you so, so much for even being
You're welcome.
able and being willing to sit and talk with us. We don't take you for granted. And we hope that we'll connect again sometime. And we know that this is information that's valuable. And we're hoping that people truly internalize it. So thank you so much. And yeah, we can't say thank you enough, really.
And definitely use them as a resource. If any of you guys have questions, if just I'm sure they're gonna leave my information down below or
Yes.
somewhere.
Yeah,
But
we'll do that. We'll plug your information. And yeah, if anyone has questions, they can feel free to reach out.
cool,
All
awesome.
right. Thank you.
You.